So now we have Ozempic. What about Ozempic? I'm sure some will be interesting. Can we truly fix obesity on Ozempic? And this was on The Economist, on the front page. Eat, inject, repeat. And my problem is that Ozempic and Mounjaro don't fix the cause, which is the ultra-processed food intake. And we have the obesity-associated heart attack. It's a metabolic mitochondrial disease caused by ultra-processed food. Number one cause of obesity treatment failure, but also that means I have patients who have failed gastric bypass. I have patients who have failed, gastric sleeve, all right? But also patients who have failed Ozempic. They don't tell you that, okay? Is actually they continue to eat the same way they were eating. That was causing them disease to begin with, all right? And here's how it works. Basically, what's in your brain stops you eating, but also works on your stomach and your bowel, basically paralyzing it. It slows down everything so you don't get absorbed. And when you do that, slowing everything down makes you feel full, and then you stop eating, all right? There are good news and bad news about that. And the good news, it drops the insulin. Actually, we know that if you lose 10% of your body weight, that helps you already normalizes the diabetes. And we have a study that just came out, last year, November, in New England Journal. And again, I'm only presenting you the study to prove a mechanism, to prove a point. I'm not saying this is the ultimate solution, although now this is approved, and I have patients for which, if they're obese and they had a heart attack and their BMI is over 30, I offer it. Okay. I also say that if I rather offer it to you after I already tried for real, getting rid of the ultra processed food. If you know, that's fine. And some need it. I mean, you need some kickstart and some help because you're addicted to certain food. I will use it temporary, but here's the deal. And what we've shown from this medicine, somebody had a heart attack. If we drop their weight by 10% with 2.2 milligram dose or Mounjaro equivalent you actually prevents in 5 years, reverses prediabetes. All right, so changing the food intake to the point that you lose weight enough so you slow down diabetes or reverse, then it actually helps also with fatty liver, insulin resistance, and that ratio I was telling you, triglycerides to HDL ratio, all right? And it just proves the point what I was saying, that we all, as cardiologists, heart doctors, we should probably tell you, and not that diabetes actually starts as metabolic syndrome, that's stage 1. 10 years later, you have the pre-diabetes, we have ways how to do that, and then 20 years later, we have stage 3 when the hemoglobin A1C goes up. And now we have evidence that if I use a drug that works between preventing stage 2 to go to stage 3, actually I reverse and I don't get heart attacks. And incidentally, we also lose 10% of our body weight. But that's not how it works. It works by fixing the insulin-resistant diabetes and fatty liver. All right, Ozempic, you are on it. Fine. So even with rescue decide to give it on you, and I do give it, I offer it, don't get me wrong, I'm just saying it, I want you to get the best of both worlds if you were to be on it. Why? Because if you actually eat the proper way, you almost don't get any side effects. And also I can take you off after 6 months or a year. But if you keep eating the same way, not only do you get the side effects, but also you're going to depend on it, and you'll never come off. Okay, so here's the side effect, call it minors. Now, I don't know about you about nausea, but to live every day with nausea, that's not life for me. It's the most disgusting symptom I ever had. But if that works, that's fine. Constipation, some people get constipated. Why? Because it slows down, makes lazy your whole gut. So you get constipated. Some people get diarrhea. Major. 1 out of 10 will have gallbladder, we call it events, cholecystitis, gallbladder stones, you name it. You can get pancreatitis, you can get gastroparesis, which is basically your stomach is paralyzed, bowel obstruction. We have over 20 case reports in the United States of people who died from that. All right, so it's extremely rare, but considering that we have millions and millions of people on it, it's going to be less rare soon. It can lead to death, and you thought you're just going to lose some weight, not dying. Now it's rare. And what happens initially, the original study was published in New England Journal showed that you have 400 to 700% increase of those events. Now there's one that just came out in JAMA last week, and they said, no, there's no relationship. But we excluded the diabetics. I said, wait a minute. We have Ozempic that you give it to pre-diabetics, that's just for weight loss. And yes, the presence and duration of type 2 diabetes, you're already diabetic, you're more likely you're going to get side effects. Why? Because I show you, to get to type 2 diabetes, you already been through pre-diabetes for 20 years. So the longer you have that, the longer you have high insulin, the more likely you have stomach that already has problems, and you get, diabetic gastroparesis. So yes, wait on pre-diabetes, then if you stop, it goes back to 6 months. Now, careful if you are type 1 diabetic or type 2 and you're on insulin. You see, doctors, particularly endocrinologists, are very shy of starting you on Ozempic if you need also insulin. I personally, I will not do that unless I have a diabetes expert on board, and I don't do it. I ask them, hey, you monitor this but if I can, let's say you're type 2 diabetic, if I can get you off insulin, or the other one is glyceride, with food, then I can consider Ozempic, because the only problem is low blood sugar, but only if you're on insulin or glyceride. So that's a possibility. Now, cost and disparities, some people can afford it, some don't. Not that it matters, but look, I think it does matter, at least for a politician, for us. Here is the estimated U.S. healthcare cost of this drug. If everybody, we give it to everybody fair who deserves this. 2.1 trillion a year. Current U.S. healthcare budget, 4.5. So half of all our healthcare budget will be this. And there are some people now, you need to know if you're on Ozempic, and you need to have any kind of operation procedure. I'm talking about colonoscopy, endoscopy. You need to be off this drug probably at least 3-4 weeks before. Anesthesiology, why? Because we tell you don't eat anything after 12 midnight, it ain't gonna work with the stomach that's been super lazy from Ozempic, because you could have food from 3 days ago there. So you really need to be off at least 4 weeks, and some people need to off more, because it reduces the risk of aspiration pneumonia and food. It's a big deal. And last but not least, I told you about sarcopenia. Anything that makes us lose weight, we don't lose just fat, we also lose mass and proportion. And we need to start exercise if you were to use Ozempic. Absolutely, because you want to lose fat and not muscle. Okay? Very important.